You're muted.
Great way to start out there. Hello, everyone, and welcome to our webinar regarding our new telehealth services benefit program. My name is Maura Snyder, and I'm a Child Care Resources Coordinator with the Child Care Development Program at the Department of Welfare and Supportive Services with the state of Nevada. Over the last few years, we've had an influx of funds come in because of our COVID relief funding. We wanted to find ways to not only help people in the short term, but also help people in the long term. So we did the stipends, and now this is one of the other things that we're trying out here. We're also working hard to really professionalize the field. And one of the ways that we're doing that is to bring in benefits that are so desperately needed, especially for this profession. While we recognize this is only a start to a much bigger solution, we hope that it can help relieve some of the stress and show you that we are listening and that we do appreciate the monumental job that you do on a daily basis. So with that funding, we have partnered with the Nevada Registry as well as Optima Insurance and Allied Health to bring you coverage for 2 years for you and your family. I'm going to go ahead and turn it over to my colleagues so they can go over the details of what it is and how it works. We have Shelly and I with the Nevada Registry, Branda DeCesar with Optima Health, and Michael Goff with Allied Health. So please feel free to add any questions or comments in the Q&A chat box or the regular chat box. Those are both located at the bottom of your screen there. And we'll go over those questions at the end of the presentation. So I'll go ahead and turn it over to my colleagues.
Great, thank you, Maura. I am Shelly Nye. I'm the program director for the Nevada Registry, and I'm really happy to be here tonight to talk to you about this exciting new program. We really appreciate that you're spending part of your day with us after probably what has been a very long day already. So as Maura mentioned, this program grants eligible registry members unlimited telemedicine calls and up to 10 teletherapy sessions per year per family at no charge for up to 2 years. Open enrollment for the program is going to begin in just a few days on January 15th. So it's going to be available for 2 years from February of this year through February of 2025. And benefits for those who opt in right away will go into effect as of February 1st. So we're down to the wire here. So we have a couple days away from enrollment and a couple weeks away from accessing those benefits. So information about the specific services that you'll have access to will be shared in a few minutes. But first, I'd like to talk a little bit about eligibility. The criteria for the telehealth services program is really two-part. The first is that you must be an active member of the Nevada Registry. Part two is that you must be working in a program that's eligible as defined by the Division of Welfare and Supportive Services. The list of eligible program types is listed on your screen. So if you work in any of these types of programs and you're an active member of the registry, you'll be able to enroll. The good news is that the enrollment process is quick and easy. So I'm going to walk you through sort of what it takes to initiate the enrollment process for the program. Can you guys see my online portal screen? Okay, so we're going to log into Sally Nevada's account, which is just a test account that we've created to be able to show you how the program is going to work. Whoops, I'm sorry. Let me try that again. So beginning on January 15th, if you're eligible for the program, once you log into your membership account, you're going to see a new yellow tab titled Telehealth Services Benefit Program. Click on that tab, and if you scroll to the bottom of that window, the link to begin the enrollment process is right there. So just like with the stipend program, you're first going to be required to confirm that your personal information and your employment information on file with the registry is current. If you need to make any updates, you can do that right here. You can submit your updates to the Nevada Registry for review and processing. And then once those updates are processed on our end, you'll be granted access to the enrollment form. But if when you log into your account and you click on this tab, you see that everything is current, you'll confirm that information by clicking on the 2 confirm radial dials. And when you do that, the rest of the enrollment form populates. And really, this is just a series of statements that helps you better understand how the program is going to work. So what you want to do is carefully read through each of these statements that really just acknowledges that you understand how the program works and also allows for information sharing between the Nevada Registry, Optima, and Allied Health. Once you've read through all of those items, You'll electronically sign your enrollment form and hit the submit button. And that's it. So it's quick and easy. So what you'll want to do right now between now and the 15th, when the program officially opens, is log into your account, check your employment information, check your personal information, and submit those updates now. You can get a couple days ahead of the game if you do that now. And then you just sort of anxiously wait for it to populate within your account. After you've submitted your initial enrollment form, this tab still is present in your account, but now it's changed to information that tells you about what to expect next. So there's going to be additional things that you need to do to officially opt into the program, but there's also a bunch of great resources here that I really encourage you to take a look at, because there's FAQ documents, there's information about how the services work, and probably many of your questions might be answered by reviewing some of those documents. So if you have questions about how to access the enrollment form, or if you're not seeing the tab on the 15th when you log into your portal, but you believe that you're eligible, please feel free to give our office a call, or quickest responses via our contact us page on the Nevada Registry website at nevadaregistry.org. If you click on the contact us link, and then if you indicate that the telehealth services benefit program is your reason for inquiry, that's going to be the best way to get the quickest response. So again, thank you for being here tonight. We appreciate you so much, and your commitment to children and families in Nevada. With that said, I'd like to turn it over to Brandon DeCesar with Optima Benefits and Payroll, who's going to talk about what to expect after you submit your initial enrollment form.
Perfect. Thank you very much. Let me just get my screen up here for you guys and kind of talk to you a little bit about my role in all of this. So my name is Brandon DeCesar, president of Optima Benefits and Payroll. Was fortunate enough to help the state of Nevada pull this program together to be able to offer to all you childcare workers in the field. And obviously with Shelly's help in the registry, really done a fantastic job with, trying to make this as easy and streamlined as possible for everybody here to get enrolled and to be able to start utilizing these fantastic services. So my role, of course, is going to be to kind of help facilitate and make things easy for everybody to use services. So if there are issues, there are questions, you're maybe having problems with access to care, or just anything that might be going on within the program that you need some guidance with, that's where Optima will be able to be your go-to for those types of questions or issues that you may run into. And so I encourage you to reach out, send an email to us if you have questions as you kind of start on the program. I think Shelly alluded to the fact that there's additional steps even after you sign up. So once you sign up on the registry, there is a next registration that will need to be done. And so you'll receive an email both from Ally Health and potentially from Optima as well, just because we want to make sure that you're provided the information. So Ally Health, as always, will send you information about the program to make sure that you can register, but we're also going to try to help coach you through that process so that you guys can get access to care, because registration is an important part under the Ally Health programs to make sure that you are set up to receive care. That's also when you're going to add family members to the program. So your initial process, of course, is just you signing up, but the next step of registration that you're going to receive from Ally Health and or Optima is going to be your actual registration into the program, where we may ask some, medication questions, as well as that's where you'll be able to add your family members to the program, as all your family are included and covered under the plan. It's not just the employees, it is the entire family. So be on the lookout for that in your emails. Optima being partnered with the state of Nevada, we're also working on additional programs to make available to you. And so in the coming months, we're hoping to have things like dental and vision and whole life insurance that you'll be able to also elect and enroll in. So just be on the lookout from that from me and my team. And if you do need anything, certainly reach out to us. We're happy to help and do anything we can to make things easy for you. But we do have Michael Goth here with Ally Health. He is the guru of all things telemedicine and teletherapy. So I'm going to let him kind of walk you guys through how the program will work itself and give you the ins and outs of how you can receive care through this great program. So thanks for your time.
Thank you, Brandon. And let me share my screen. I have a brief little presentation to walk through with everybody. And I think this will make it much easier for you guys to understand. So just bear with me 1 second while I open this up. All right. Come on. Brandon, can you confirm you can see that?
You're in.
Okay, so first off, as we go through this, if anybody has any questions, you can type them in the chat, I think below, and at the end, we can just kind of rattle through any questions that do come up. But our company, Ally Health, we are a virtual care company, which our two main products are telemedicine and mental health counseling. Both of these are services that are being provided through the Child Care Development Program and through the state of Nevada, as was mentioned. So this is a fantastic program for you and your families, and it's something that you guys are getting just for, you know, for working in the industry and the program that you guys do work in. So there's two main products that you'll be getting once you opt in for this. Number one is telemedicine. So telemedicine is kind of a fancy way of saying doctors by phone or video. It gives you the ability to talk with a US board certified doctor for anything that's not an emergency. It's available 24/7, and it's for all the routine illnesses that come up on an everyday basis. You know, colds and flus and sinus infections and, you know, respiratory infections. I'm not a physician, but that list can go on and on. These are all the things that are not an emergency. If it's an emergency, you obviously need to go and seek medical attention. But for all the routine illnesses for you and your family, this is a program that you can absolutely use at any time. So the doctors themselves are all US board certified doctors. They are licensed in the state that you're in at the time you talk with them. So if you're in the state of Nevada, you're going to talk with a doctor that is licensed in the state of Nevada. If you happen to be traveling for any reason, you can use the service in all 50 states. You can call and you'll talk to a doctor that's licensed in that state. All the doctors have an average of about 15 years of experience, and most of them are everyday practicing doctors that are working in a hospital, in an ER. They might have their own practice working in a health system, and they are blocking off times during their week to field these calls. They go through some additional training, communicating and diagnosing patients over the phone and through video. Many of them are multilingual. So if you have, for example, Spanish as a primary language, you can both call in and talk with the person to set you up with a doctor in Spanish, as well as talk with a doctor in Spanish. All the providers go through a background check, and there's over 3,000 doctors as part of the network across the US. The way that the service works is that when you first contact Ally Health to talk with a doctor, we're going to go through a very brief intake. This is something you can do over the phone. This is something you can do ahead of time via our mobile app or on the web. And then the doctor will call you back. The average callback time from a doctor is only 6 minutes, which is just an incredibly short period of time. All of us have been to a doctor's office before, and if any of us ever had a wait time of 6 minutes, including inside the exam room for the doctor to come in, we would be very happy about a 6-minute wait. So 6 minutes is great. Of all the calls that we receive, 94% of them are resolved. And when we say resolved, we just mean that you don't have to see a doctor after the fact. So our advice is to use this as your first point of care. Again, if it's an emergency, you need to go seek medical attention. But for everything else, you call in and speak with a doctor. The copay for this program is zero. There's no cost at all for you on a monthly basis or on a per consultation basis. So we recommend is use the service. If you happen to fall in the 6% that the doctor says, you know what, this is not something we can do over the phone, you need to go seek medical attention, that only happens 6% of the time. So 94% of the time, the call ends where you have a diagnosis, and then the doctor has the ability to call a prescription into your local pharmacy. So it's the same pharmacy you always go to. You can designate that. If you do have any type of insurance, you can use it for your prescription, but the doctor will call it into that same place. Everything we do is all HIPAA compliant, so all of your records and health records are very secure. The doctor can also send a transcript of the call to your primary care doctor. So if you have a doctor you go see on a regular basis, and you want them to know that you called the doctor because of whatever issue, they can send a copy of all their notes over to that doctor. And then if after you speak with a doctor, if your condition does not get better or potentially worsens and you want to talk with that same doctor, you can go ahead and do that. You don't have to start over with a new doctor. There's 3 ways to access a service. Number 1, you can just call in. You call into our number. Again, it's 24/7, 365. You're going to talk with a care coordinator. That's kind of like the person that checks you in if you go to see a doctor, and then they're going to have a doctor call you back. Again, it's a 6-minute callback time. You can do a video call with the doctor. So if you actually want to have a face-to-face with the doctor, maybe you want the doctor to look at, you have pink eye or symptoms of pink eye. You want the doctor to be able to see that. And you can also do a consultation through our mobile app. So again, with the mobile app, you can schedule an appointment, you can have a doctor call you back, and then it will be, you can do phone or video through the mobile app. So some of the advantages of the program for you guys, number 1 is you'll save copays. So depending upon if you have insurance, if you do, what the insurance is like, you don't have any copays with this program, it's 0. So instead of going to the doctor, I know my personal copay, I think is about $35 if I were to go to a doctor. So I'm going to save the copays. I'm also going to avoid any deductibles. A lot of plans today, because health insurance is so expensive, have high deductibles. So there's no deductible to go to. You can also care for your family from the comfort of your own home. As a dad, I can tell you that this is a fantastic benefit of this, to not have to take your kids to the doctor at 10:30 on a Saturday night or whatever time of the night when they're not feeling well. You can call and talk to a doctor. It's peace of mind for you as a parent, as well as you can just go out 10 minutes later or whenever the prescription is ready and pick it up and not have to sit in a germ-filled waiting room with your child who's not feeling well, pay a couple $100s to urgent care. It's a phenomenal benefit for you and your family. You can avoid using paid time off, any unpaid leave, and just get a lot more done. So it is a wonderful program. I think because of the pandemic, everybody has heard now what telemedicine is. Prior to the pandemic, telemedicine was very popular. Now it's just a normal way of visiting a doctor. And again, you guys are in the fortunate position that this is being paid for you 100%. So the second service I want to talk about is behavioral health. Behavioral health, also called teletherapy, also called mental health counseling. It's all the same. And really what it is an opportunity for you to talk with a mental health counselor for a variety of reasons. So some somewhat alarming stats is that about 1/4 of the US population has an untreated mental health condition. The average wait time currently to go and see a mental health counselor, like a psychologist, is 60 days or more. That's not through our service. That's if you were to try to go find a psychology practice that is accepting new patients. Over 50% of the counties in the US don't have one mental health professional. And about 2/3 of people who have a mental health issue don't seek treatment. The main reason that people don't seek treatment is 2 reasons. Number 1 is lack of access, and number 2 is the stigma. And I'm going to talk about that in a minute. So since June of 2020, which is when we were right in the middle of this pandemic, since that point till now, the demand and the amount of mental health counseling has increased by 574%. You guys may see this in your own households. You may hear from it from coworkers or anybody you work or anybody you come into contact with, but mental health counseling is in such high demand right now, and it continues to go up. What that means is a lot of people need help and a lot of people don't get help. And the reason they don't get help is a couple of many reasons. Number 1 is they need to recognize that help is needed. There's need to know the awareness about the service. Most importantly is a need to be able to access the service. As I mentioned, if you try to go find a practice today that's accepting new patients, the average wait time is 60 days or more. Many practices today, mental health offices, are full. They're not taking any new patients at all. With our services, the average appointment time is about 5 to 7 days out. So you could call today and you can have an appointment with a psychologist inside of a week. You have the ability to go into our mobile app or on our website. You can see all the providers that are licensed in your state. You can read their backgrounds. You can see where they went to college, what they specialize in. You can hand select the counselor you speak with. And then from there, you can go ahead and schedule the appointment that you want to, with the person that you want to see. One item about the program that everybody loves is that if you want to have continual appointments, you can talk with the same mental health counselor every single time. So if you talk with somebody today and they give you some things to work on and you talk with them again in 2 weeks, it's the same exact person. So you're going to build upon every consultation you've had, as you go through this therapy. And the other reason that people don't use this is just fear of privacy and the stigma around mental health. For a long time, if you had a mental health condition, people looked at that differently. So a lot of people don't want to go. They don't want to be seen at the mental health office. They don't want to have any of their family or friends know about that. Now, through our program, you can sit at home. You can do a video call just like this with a licensed clinical social worker or a psychologist. It's about a 1-hour consultation for anything that you could potentially think of, whether it's addictions, depression, grief, PTSD, anxiety, stress. There's a long list of these things. These are conditions that these individuals are counseling for on a daily basis, and they can continue to do that. Again, you have the ability to look at these profiles of these counselors, and you can kind of pick who you want to talk with. So if there's somebody who specializes in stress, or maybe you're a man that only wants to speak with a man, or a woman or a female wants to speak with a female, you have the ability to kind of sort through that, see their availability, and schedule an appointment with them. So the provider network is the largest virtual care network in the US. It's over 2,000 state licensed and board certified therapists nationwide. They go through some additional quality control, the NCQA, that they have to meet. All the privacy laws of HIPAA and PHI information. It's all very secure. It's the highest level of security that HIPAA and medical records can be kept at. And the therapists have an average of 10 years of clinical experience. So these are, it's not a call center or anything like that. These are normal everyday therapists. And again, they're part of this network. And that is just a part of their, their business practices to see patients through our network. So the provider types are there's psychologists, psychiatrists, licensed professional counselors, there's marriage and therapist counselors, there's licensed clinical social workers. The mental health counseling is broken up into 2 categories. The first is what we call talk therapy. So talk therapy is exactly what it sounds like, where you'll talk with a licensed clinical social worker or a psychologist for an hour's time for whatever issue it is you want to discuss with them. If during the course of that counseling, that particular psychologist and you as the patient uncover something larger that may require medication for management of that requires a psychiatrist. Psychiatrists can prescribe, psychologists cannot. So we can connect with a psychiatrist as well. I will tell you that there are very few psychiatry practices in the US today that are accepting new patients. There is such a small, limited number of them, and they are overwhelmed with patient requests. So the ability that we can connect with a psychiatrist is really a big deal. So the plan that is part of this, again, it's a $0 copay for the first 10 sessions per family per year. Most families don't go over 10, which is why we arrived at that number. If you want to go over 10, you can. You just pay the consultation fee for the 11th consult and forward. The consultation fee for a 1-hour clinical session with a psychologist is $90, which is a discounted rate. Most psychologists are charging $125 to $150 an hour. That only would apply if you go over 10 inside of a year. So if you want to do that, you're welcome to. We just don't want to, if someone gets to 10, we don't want to cut them off and say, sorry, you can't talk with a psychologist anymore. So it would be 10 for the first year. And then once the year resets, it's another 10 every single year. Again, it's for licensed therapists or psychologists, and access in the privacy of your home anytime you want, really on your schedule. So next steps on how to access it, again, is really what Shelley went through in the process to go through the website and opt in for the program. Once you've opted in, once the program goes live, you're going to get communication from us that says, here's how you access your account. It's going to have some information. It's going to have a link that you can click on to set up your account. You can add your dependents. You can fill in your medical history. It's very simple. It's very self-explanatory. So the biggest thing now is just to follow what Shelley had said, is just to raise your hand and opt in and say, yes, I want it. It's a wonderful program. It's free. It's going to save you time, money, aggravation, everything. So definitely go ahead and opt in. Brandon, I think that's everything I had to cover. I'm happy to answer any questions that may have come up.
Looks like we do have one question in queue here that I just saw pop in. So let's see what we got. Can I still enroll even if I already have an insurance through my company? This benefit you provide will really help me save. I can answer that question live, and the answer is yes. This has no bearing on your other insurance, so you can have this policy alongside your major medical. This is certainly not meant to replace anybody's major medical insurance, but it will help obviously save you money on copays and other costs and time and all that good stuff. So no bearing whatsoever. This is completely separate from major medical.
And Brandon, just to piggyback on that, you also, if you have major medical insurance and you have a prescription plan, you can use your prescription insurance to cover the cost of the medication that is prescribed by our doctors. You don't have to have your doctor prescribe in order for your insurance to cover it. So you can talk to a doctor with a $0 copay. They call you in whatever amoxicillin for your child, and you go there, or if you have, insurance for your child, or whether it's for you or not, you go there, you pick up the prescription, you pay like you normally would, and they don't have to be interchange like that.
And now to piggyback on that is that there's also a prescription discount card that is available through the program as well. So if you don't have insurance, or you want to see if there's coverage that might be available for your prescription that is maybe less than what you're paying, we do have a website that would be available for you to do a search to see what that prescription would cost through our discount card. So also another little perk along with just the regular teletherapy, telemedicine. Okay, Michael, you might have to answer this one. How would they test for a UTI, or what if we need lab work?
So if you have something that you are concerned about that you talk with a doctor on that requires typical testing, depending on the discretion of the doctor, they can go one of two ways. One, they might say, listen, based on this, you need to go and here's what it sounds like. Here's my recommendation. They'll give you guidance, and you may have to go and get lab work done. Our doctors don't interface with LabCorp or anything like that, but they can give you the direction of what to do. Most of the time what happens, and I can give you a personal example of this, within telemedicine in today's world, there's protocols for doctors to isolate and narrow down the likelihood of a particular diagnosis. For example, I called in at one point and I had all the symptoms of strep throat. And I'm one of these people that when I was younger, I had strep throat like the same day every year for 4 or 5 consecutive years. It was like clockwork that I would get this. So when I talked with this doctor, I gave him all my symptoms. And he asked me some other questions. How old are you? What about this? What about this? What about this? So he said, based on everything you gave me, there is a 97% chance that you have strep throat. Unless we do that little throat culture with the Q-tip in the back of your throat, I can't emphatically tell you that you have strep throat. But with 97% certainty, I can tell you have it. So to be safe, let's treat this. And he called in a prescription for me. Without a shadow of a doubt, I knew I had strep throat. He knew I had strep throat. But as a medical professional, he could not say 100% he could, but he does have the authority to call in a prescription based on what he feels my condition was at the time. So for any other conditions that are similar to that, strep throat, UTI, anything that requires testing, the doctor does have the ability to diagnose it within a very, very small margin of error. If you happen to be somebody who says, I want 0 margin of error, that doctor may say, you know what, you really should go see your doctor. They're going to do a quick lab test or culture or something like that, and they can tell you. So it depends on the doctor, but the protocol has really changed a lot to go more toward based on data and statistics to do that diagnosis for things that require an absolute, medical test to prove it out.
Okay, next question we got is the blood work covered?
So blood work is not covered. The blood work would be something that if somebody has to go and get blood work done, that is something they would go through their insurance. Think that was all the questions.
Yes, I believe you are correct. So let's see here.
And Brandon,
another one just came in.
popped. Yep.
Yeah. If your family member is not on your insurance, can they still use the program to get services? Example, husband has high blood pressure. Yes, absolutely. Everybody that's in your family is eligible to be covered under the plan. Makes no difference what their affiliation is with or without other medical insurance or not. Everybody is eligible to be on the program.
Exactly. And it doesn't matter if you have health insurance, you're eligible for the program, and so are your dependents. If you don't have health insurance, you're eligible for the program. This is completely independent. The idea here is this is something that is going to save you from using your insurance as much. And it's going to provide you a lot of convenience because you can do it from home. And it's going to, just save you time and money. And the best part about this is that it's being paid for by somebody else. So that's the best kind.
Perfect.
Yeah.
Maura, do you want to close or you want to just?
Yeah, let's see. I just wanted to make, I was on mute, I know. I just want to make sure there's no other questions that wanted to come in, but I appreciate all the questions that were asked. Are really good ones out there. So thank you so much again for the information, all the effort and time everyone has put into putting this together. Next steps for everyone is to make sure that you are registered on the Nevada registry and make sure that all your information is correct and updated so that you can hopefully get that little bar when it comes open on the 15th. Again, the 15th is the start of the open enrollment, and then the benefits will start on February 1st. And I think that is it. So thank you so much. This will be recorded and posted so you can go back and see any of the contact information that you might need, or listen to this again to make sure that you understand everything. So that's all I have. So thank you for coming out and seeing us.